Hello. Thank you for tuning in. This is a roundtable discussion series between hematology, nephrology, cardiology, and neurology, with main focus to discuss the use of factor 11 and 11A inhibitors as novel anticoagulants in the treatment and prevention of stroke, venous thromboembolism, and arterial thrombosis. It's as we have learned over the years from what we know about congenital factor 11 deficiency, factor 11 seems to be playing a much more important role in the process of thrombus generation, so thrombosis, than in hemostasis. And really, over the past, I would say, decades or so, or even more, there have been enthusiasm about developing factor 11, 11A inhibitors as a novel anticoagulant that could treat the thrombosis or prevent thrombosis without increased risk of bleeding, which was thought to be this great anticoagulant option. Um, so there are really many active ongoing phase 2 and phase 3 clinical trials, really using factor 11, 11A inhibitors in various indications, and to again prevent and treat thrombosis. There are many factor 11, 11 inhibitors that's being actively investigated through different mechanisms, including antisense oligonucleotide that targets factor 11 mRNA to inhibit the expression of factor 11 in the liver. There are monoclonal antibody against the factor 11, 11A, and there are also small molecule inhibitors of factor 11, 11A, of which have the essential goal or have the essential achievement of reducing the factor 11 levels in patients, again, thereby to prevent and treat thrombosis. So we're very excited that there are again many ongoing phase 2 and phase 3 studies. We're excited and anxious and wait for the large phase 3 definitive trials for their results, and hoping that if the results are as expected, that we can have a new therapeutic landscape for these very sometimes very challenging patient population.